Liver disease is often associated with alcoholism, but it can also impact people who consume very little or not at all, and is directly linked to your relationship with food. Joining us now with more on non-alcoholic fatty liver disease are Docs Outside the Box and Kids Outside the Box founders, Dr. Garner and Dr. Teekell-Taylor. Doctors, it's always so great to see you.
Glad to be here.
So doctors, I've been hearing a lot about this problem. What is this and how does your clinic treat it?
So liver disease comes in many different flavors, and it can be caused by genetic issues, too much alcohol, too much food. Specifically today, we're talking about too much fructose. And then the body takes that fructose and starts making fat. And that can lead in extreme conditions to cirrhosis.
So why does the liver itself start storing this fat?
So the liver starts storing the fat because our body was never intended to have this much fructose. And once it gets bombarded, it makes a lot of fat, and then it wants to correct itself, and it starts making scar tissue. And that leads to fibrosis and then cirrhosis.
So how dangerous is this for patients?
It's more dangerous than you might think, Gayle. We have noticed in our clinic a pattern, specifically with COVID. All of our patients that did poorly with COVID over the last 3 years had an underlying fatty liver. So there's an association there. Not only that, a fatty liver is a diseased liver. It's an inefficient liver. It's straining the kidneys and the pancreas. And because the liver produces and packages our cholesterol, it contributes to a terrible cholesterol panel.
And is this treatable for patients? Because you say it can lead to psoriasis, but is that treatable?
Oh, absolutely. Best is prevention, but if we suspect a patient has a fatty liver, it's easy to determine with non-invasive testing such as ultrasound. Once we find a fatty liver, we teach these patients what to avoid in their life to help the liver stop doing this, and we also give them supplements to help the liver mobilize the fat. The thing they have to avoid the most, as Lana said, is fructose. And if you've been in this country since the 1970s, you've been eating a tremendous amount of fructose in the form of high fructose corn syrup, which some gastroenterologists refer to as a weapon of mass destruction for this reason. But to treat it when it's mild is fairly simple. When it gets to be more severe, when the patient has fibrosis, stiffening of the liver, now we have to be more aggressive. And what we've done in our clinic is develop an off-label novel treatment using a machine we have, which is normally used for cardiac patients, called EECP. This forces arterial blood through the liver, and the patient does this as an outpatient for 7 weeks, and we've seen great results. Our first patient we used this on about 4 years ago went from cirrhosis, which is F4, or the highest level, down to F1 in terms of stiffness. So it's a real help, but again, the best treatment is prevention.
You guys are so forward thinking. I know it's why you have such a thriving practice. I really appreciate you coming on, because I know there's so many people out there that might be struggling with this and not even know it. So first thing is prevention, like you say, but definitely get tested. Doctors, thank you so much for joining us on Bloom today.
Thank you, Gayle.
Yeah. And if you want to get a hold of Docs Outside the Box and Kids Outside the Box, just pick up the phone right now. They're in St. Petersburg. The number to call is 727-498-8898, or you can visit online at docsoutsidethebox.us. We'll be back with more Bloom right after this.